Hi everyone, this is Professor Cordero from SMS 351. We are getting back on track, so I'm going to be doing some recordings for you of the different chapters so we can stay on track with our syllabus. So I'm recording chapter 4, which is going to be on infections. So hopefully you've already read the chapter. The first thing we're going to start with is a review of some questions from chapter 3. So you can use your notes for this, you can use your textbook, or you can just test your memory and see how much of the information you remember. So the first question on here is, what cells are required to process and present antigens from foreign material as the initial step in the immune response? We have certain cells in the body that act as waiters, and they identify and present those antigens to the immune system so that it can take care of or clear that antigen from the body. So the primary cells that do this are called macrophages. So macrophages are the cells that process and present the antigens to the immune system and start the immune response. The next question on there is, humoral immunity is mediated by what type of cell? So the specific cell that's responsible for humoral immunity is the B lymphocyte. The next question on here, I'll actually give you some choices to choose from. So which type of immunity is provided by a vaccination? So the choices you have are active natural, active artificial, passive natural, and passive artificial. So the type of immunity that's provided by a vaccination is active artificial. So we have an active vaccine that's put into the body artificially, usually an injection, and that provides active artificial immunity. And the last one on this slide is, a patient had an episode of influenza 6 months prior, and now they've been exposed to a mutated strain of the same virus. So what type of response will develop in the body? Will that person have a primary immune response, or will they have a secondary immune response? So the answer for this one is, the person will have a primary immune response. Even though they've been exposed to that strain of influenza 6 months prior, they've now been exposed to a mutated strain of the same virus, and because it's different, they're going to have a primary immune response. So here's a few more questions for you. When an allergen binds with immunoglobulin E antibodies on mast cells, this results in a release of chemical mediators. So what is this reaction called? The choices you have are cytotoxic hypersensitivity, immune complex hypersensitivity, type 1 hypersensitivity, or a type 4 hypersensitivity. And when an allergen binds with that IgG antibody, we get a release of chemical mediators, and that's called a type 1 hypersensitivity reaction. The role of the memory cells is to... So what do those memory cells do for us? Remember the memory. You have a memory in your body just like a computer has a memory. And the role of the memory cells is to support the immune response by recognizing certain antigens. So once you've been exposed to the prior antigen, your body will recognize that and have a secondary immune response to that. So the next question on here is, incompatible blood transfusions result in, and what that results in is it results in hemolysis or destruction of erythrocytes, and the erythrocytes are the red blood cells in your body. The next question is, an autoimmune disease, an example would be lupus, means that it cannot distinguish, the immune system cannot distinguish self from non-self. So when you have an autoimmune disease like lupus, your body cannot recognize what is normal cells and then what is the antigen or the non-normal cells in the body, and it attacks them. And then the last thing is, name a distinguishing clinical feature of systemic lupus erythematus. And what happens with this condition, because it does affect the entire, all the cells that are in the body, it actually causes inflammation of multiple organs. So they'll have different parts of the body that are affected by lupus. And then we have one more page of questions for you that deals with HIV, and then we're going to talk about some of the autoimmune disorders that are pretty common. So what are the target cells for HIV? Diagnosis of HIV positives means that what two things are present in the blood. HIV infection impairs humoral or cell-mediated immunity. How is HIV transmitted? What three conditions frequently occur in AIDS patients? And then what is the current treatment for HIV? So what I'm going to do with these questions, I'm actually going to put a presentation for you so you have an example of what one looks like. And then it will answer all these different questions for you. So make sure that you've read this information in your chapter, that you're familiar with HIV and AIDS, and we'll talk briefly about it in class. So let's get started talking about autoimmune disorders. So the photo on the top right is what systematic lupus erythematus looks like, and what you'll notice on the face, there's a distinguishing characteristic that people have when they have this disease. And if you remember back to Harry Potter, if you remember Professor Lupin turned into a werewolf. And people that have lupus typically will have this wolf-like rash on their face. It kind of looks like the markings that are on the picture of the wolf below it. So, it's interesting that the author of Harry Potter was smart enough to think about lupus and calling the character Professor Lupin and have him develop into a werewolf. So an autoimmune disorder occurs when individuals develop antibodies to their own cells. And sometimes there's a primary deficiency where there's failure somewhere in the system. Maybe the bone marrow isn't producing the right stem cells. Maybe there's a secondary response where the immune system stops working because of a specific cause. People that have had their spleen removed or had a splenectomy, that's a big part of the immune system, and that might be missing. If they've been taking some type of an immunosuppressive drug because they had an organ transplant, maybe they've had treatment for cancer. So there's lots of reasons when a person would develop antibodies to their own cells. And those antibodies attack the individual tissues, resulting in multiple organs failing. So some disorders include Hashimoto's thyroiditis, myasthenia gravis, Graves' disease, and the last one, which I've mentioned already, is systemic lupus erythematus. So these infections usually come from normal flora in the body. Typically these people will have a suppressed immune system, and they'll be open to other infections. So anyone who has an immunodeficiency disorder must be given an antibiotic before they have an invasive procedure. And typically when you go to the dentist, you don't consider that an invasive procedure, but when people who have some type of an autoimmune disorder have to go in and get their teeth cleaned, they have to take an antibiotic because of their suppressed immune system. So let's take a look at these, and these have a lot of clinical characteristics that are very easy to spot on people. So Graves' disease, it's one of the leading causes of hyperthyroidism. So hyper means high, and if you see hypo, that means low. That's how you can remember them. So Graves' disease, it's the leading cause of hyperthyroidism, and hyperthyroidism is an autoimmune disease, and the immune system literally attacks the thyroid gland that's located in the throat, causing it to grow, and it produces excess thyroid hormones. So the thyroid secretes hormones that control your body's metabolism, and metabolism is vital in managing things such as your mood, weight, and mental and physical energy levels. So lots of complications can be produced because of this extra thyroid hormone that's produced. The good thing is it happens in less than 1% of the population, and it's seen more commonly in women than in men, and usually up to 8 times more prevalent in women than men. So usually found in middle age, but occasionally found in children and in adolescents. And one of the things that you see a picture on the top left, that's called Graves' ophthalmopathy. And what happens with that is the eyeball bulges out past the orbit or the eye socket. And this happens because the tissue and the muscles behind the eye start to swell, and it kind of pushes and forces the eye forward. So sometimes the front of the eye, the surface of the eye, can become very dry, and people that smoke cigarettes who have Graves' disease have a few more complications and a few more eye problems because they're exposing themselves to the carcinogens in the smoke. The one on the bottom might be hard for you to see, but that's Graves' dermopathy. And typically these people may have reddening or swelling of the skin, and especially on the shins and the top of the feet. So two different characteristics you may see in people that have Graves' disease. So I definitely know that Maggie Smith from Harry Potter, she may have had Graves' disease, and I know that it's very common in The Simpsons as well. So again, causes of autoimmune disorders. So we really don't know what causes this. The exact process hasn't been established. So one of the reasons may be that the body releases large numbers of self-antigens, and then the body responds by releasing antibodies. So some of these self-antigens are tolerated by the body, but when you have suppression of the immune system, the body can't distinguish self from non-self, or it's not able to figure out what's foreign material and what cells are actually supposed to be there. So the antibodies trigger an immune response, and that leads to inflammation in the body, and it leads to necrosis of the tissue or death of the tissue. So aging may be a factor. There may be some genetic factors. I know that there are cases of lupus that involve specific drugs. So if someone has been taking an antihypertensive for blood pressure, taking an antibiotic for an infection, or taking some type of an anticonvulsant medication for seizures, may actually cause this type of autoimmune reaction. So again, we're going to look at lupus, and this is a chronic inflammatory disease that affects multiple systems of the body and multiple organs. So it involves the joints, skin, kidneys, lungs, heart, blood vessels, possibly the central nervous system, and the bone marrow. So commonly seen in specific populations, and those populations include women that we've already talked about, and typically women between the ages of 20 and 40 years old. It's also common in African Americans, Asians, Hispanics, and Native Americans. So again, no specific cause has been identified. It's multifactorial possibly, with a lot of different factors causing the autoimmune response. So treatment for this, any of the treatments for this typically reduce the immune response and inflammation. But the medications people typically will take are glucocorticoids, and one of the problems with glucocorticoids is it actually decreases bone marrow density. So we have to be careful with patients that have been taking glucocorticoids for long periods of time if we're doing any type of a rehabilitation program with them. So NSAIDs are your non-steroidal anti-inflammatory drugs, and then they have a specific physician that will take care of them, so they will typically go see a rheumatologist for treatment. So prognosis is very good right now, meaning that they'll have a good long-term result as long as they have early detection and treatment. So treatment. So there's no cure for this right now, and treatment kind of depends on what the symptoms are. So the NSAIDs, or the anti-inflammatory medications, are useful to treat the arthritis symptoms. It's very good to treat the pleurisy inflammation that occurs in the lungs. The corticosteroids are used to treat sometimes the skin irritation, and you see a picture of it in the top right-hand side. And they're actually using medication, the hydroxychloroquine. They're using that. It's an anti-malarial drug, and they're using low doses of corticosteroids are sometimes used for the skin and the arthritis symptoms as well. So because people are taking these medications, they may need to be careful of their time spent in the sun and have sun protection. And then there are certain cytotoxic drugs that can be used that actually block cell growth. And those are used for people who don't respond well to the corticosteroids, or who are unable to stop taking the corticosteroids without their symptoms getting worse. So again, I'm gonna just talk briefly about HIV and AIDS. I'm really going to work on making a Prezi for you so that we can have more current information for you. But HIV and AIDS is an autoimmune disorder, and it is a chronic infection disease caused by the HIV virus. And the primary cause of this is it destroys the T lymphocytes in the body. And if we hear again about people having a low T cell, that's what they're referring to. So HIV is when the virus is present in the body, but fewer clinical signs have developed. AIDS is when the infection is active and there's multiple signs and multiple complications. So by changing or infecting the T helper lymphocytes, you actually decrease the number of cells, you decrease the number of the cells that help with the immune response, and it actually decreases the response of both the humoral and cell-mediated immunity. So it also affects different systems. It affects the central nervous system, it affects the lymphoid tissue, the lymph nodes, the spleen, the tonsils, and it actually uses the tissue as a reservoir for continuing the infection. So right now I'm not sure what the current numbers are, but AIDS is considered a worldwide pandemic, meaning that it's not restricted to one small community or subset of the population. And the virus primarily that infects the body is the CD4 T helper lymphocytes. So there's two types of HIV. There's HIV-1 and HIV-2 that you may hear about. HIV-1 is the predominant virus that causes AIDS worldwide. So when you hear someone talking about HIV, they're specifically talking about HIV-1. Alright, so here's AIDS activity from 2008. I haven't been able to find a current one. But if you notice the prevalence of HIV in adults, you notice that South Africa has greater than 10% of the population is infected by HIV and AIDS. This is the largest area of infection in the world. It's a very difficult area to get treatments into. It's very rural, depending on the area that you're in. And right now, I'm going to estimate that probably about 40 million people are living with HIV and AIDS in the world. So Eastern Europe, it's very popular, Europe and Asia, and women actually now account for nearly half of all infected adults worldwide. And this started in the late 1970s and 1980s. And I actually remember this when I was in high school, that HIV and AIDS came out, and we didn't know what caused it then. We didn't know if it was touching someone who had the condition, drinking from a cup, eating off of the same utensils that they had used. So I remember when it happened, and right now we still don't have a vaccine for it, and we do have treatment which has improved the quality of life for a number of people who do have access to medications. So this is the interesting picture. I want you to compare where we just were, looking at the population or the prevalence of HIV in adults, and now I want you to look at where the majority of the money is spent taking care of people that have HIV and AIDS. So you'll notice that Iraq and Afghanistan have universal health coverage, and that coverage is provided by your tax dollars. That is provided by the United States of America for war funding. So they do have excellent care over there because we are paying for it here. The countries that have no universal health care system are in gray, and you'll notice that that's the United States, Alaska, parts of South America, the majority of Africa, and then Southern Europe. And then countries with universal health care in blue, and then countries attempting to implement universal health care. So Central America, north of South America, and then Sub-Saharan Africa, you'll notice that they do not have any type of universal health care, making treatment difficult. Alright, so on the left side is a representation of an HIV or AIDS virus. So that's the human immunodeficiency virus, and that again destroys the T helper lymphocytes in the body, so it prevents humoral and cell-mediated immunity. So the B lymphocytes remain the same, but the T helper lymphocytes are affected in the body. So the first case of AIDS was in 1981, and again it's considered a worldwide pandemic. So originally it was thought of as a gay man's disease. It was found in a small population in San Francisco of gay men, and it really wasn't disputed until Ryan White, whose photo was on the right-hand side, came along. He had had a blood transfusion done during surgery, and he was infected with HIV. And back then, when blood was taken, and when blood was donated, it wasn't tested for HIV and AIDS, so no one really thought about it being transferred through a blood transfusion during surgery. So he had a lot of complications. He wasn't allowed to go to school, he wasn't allowed in restaurants because we weren't sure how this was transmitted in the population. So much different now. People with HIV and AIDS, people with HIV are living much longer. They have a good quality of life. I was actually able to run with a member of the Tufts Marathon team who was HIV positive and had been living with that for 15 years. So much different now in the United States than back then in the 1980s. So remember, HIV positive is when the virus is present in the body but there's few clinical signs. And then AIDS is the acquired immune deficiency syndrome, and that's when the active infection is there with clinical signs, symptoms, and complications. So the modes of transmission. We know what they are now. So we can transmit HIV and AIDS through body fluids, so blood, semen, vaginal secretions, blood transfusions if the blood has not been tested, and all blood in the United States that is donated is tested before it's used on anyone. If you are going in for surgery, what they will typically recommend is that you bank blood, so you can have yourself or family members go in and put blood aside for you if you are having a procedure and you're concerned about a blood transfusion. So it's not transferred through toilet seats, it's not transferred through saliva, it's not transferred through shaking hands. So it can be transferred, though, in pregnant women to the fetus through the breast milk. And that's one of the problems in sub-Saharan Africa, is that women are breastfeeding their children and women are HIV positive, and then they're transferring that to their child. So HIV cannot live outside the body, and it can be destroyed with chemicals. So typically if we have an athlete who has some type of an injury, they're bleeding on the court, they're bleeding on their uniform, the HIV virus is not going to be active in whatever is dried. It can be destroyed with chemicals, so typically you use bleach to kill it, or we'll use isopropyl alcohol. So risky behaviors: multiple sex partners, unprotected sex. Healthcare workers, if they receive a needle stick from someone that is infected with the HIV virus, they may be at risk for contracting HIV. And then intravenous drug users that do use and share needles with each other. So the picture on the bottom, that's actually a condom, and when guys say that they're too small, if we can fit it over someone's head, we can certainly fit it over what needs to be covered. So clinical signs and symptoms. This is a photo that was taken in Soweto, which is southwestern township in South Africa. So when I had a chance to visit there, we were able to go into some of the townships and visit with the kids and bring them fruit and bring them candy. And this was one of the little nuggets that I loved. She was the cutest thing. So with HIV, typically people may have flu-like symptoms. They may have a lower fever. And typically with a fever, it's good to know what your baseline temperature is. Most people it should be at 98.6, but some people may run higher by a small amount. Some people may be lower, maybe 97.6. So it's good to know what your normal temperature is for your body. If your fever goes 2 degrees higher in either direction, either higher or lower, then that's when you probably want to go in and see your primary care doctor. So these people who have HIV may have a lower fever, fatigue, arthralgia, so joint pain. So when you see that, think of arthritis, and a sore throat. With HIV, flu-like symptoms, but they don't have full-blown AIDS. With AIDS, they're going to have gastrointestinal effects, so maybe they may be more prone to parasitic infections, ulcers, vomiting, diarrhea. They may have neurological effects, so general brain dysfunction. They may suffer from dementia, seizures, or they may be in a coma. Secondary infections, and the secondary infections are the primary cause of death in AIDS patients, and those are pneumonia and tuberculosis. And then the last one is malignancies, and an example of a malignancy seen in AIDS is Kaposi sarcoma, and that affects the skin, it affects the mucous membranes, and it affects the internal organs. So treatment for AIDS, I'm not going to go through all of these, but these are some of the treatments that are available right now. We do have medications that they may take one a day that are time released. I know when HIV and AIDS first came out, they had a drug cocktail of several different medications that had to be taken at once. So AIDS drugs do not cure the condition. They help to manage it. They help to postpone life-threatening complications. But there are some problems when you are doing AIDS drugs therapy. So side effects of the medications are a major concern in the treatment. There's lots of adverse effects from the drugs. And another major problem is the cost of the drugs in treating AIDS. So AIDS patients in the United States depend on insurance and government grants to get the medication that they need. So in other countries, especially in third world countries, that's the major problem with the AIDS epidemic, is that people don't have these medications available to them because they're not able to pay for them and afford them. Alright, so we're going to continue on with more things about infections. So if you want to take a little break at this point, there is more to come. So if you want to take maybe a 5 to 7 minute break, I'll meet you right back here. So we're going to continue on with our learning objectives. We're going to continue to discuss the autoimmune and immunodeficiency disorders. We're going to look at some of the basic characteristics of normal and abnormal flora in the body, the different methods for transmitting microbes, methods of preventing infection. We're going to look at the guidelines for the use and the mechanisms of action of common antimicrobial drugs, and then look at some of the different respiratory tract infections. So we're going to look at some of the terminology which is important. So microbiology refers to the study of microorganisms or microbes. So these microbes can only be seen under a microscope. So when you think of microbe, think of microscope. So different types of microorganisms include bacteria, virus, fungi, and protozoa. So these typically are classified as non-pathogenic or pathogenic. So non-pathogenic do not cause disease in the body, and they're actually helpful. You need to have these in your body. Pathogens are the disease-causing microbes. These are the germs, if you want to consider them that. So pathogenic ones are the germs. And these certain microorganisms can need a certain medium to replicate. So replication is according to a suitable environment. So they need things. They need 4 things to replicate. They need oxygen, they need carbohydrate, they need to have a specific pH in the body, and they need to have a specific temperature in order to replicate. So let's look at some of these. We're going to look at bacteria. So bacteria have different shapes. So they can be classified as bacilli, spirals, or the cocci. So we have the diplococci, the streptococci, and the staphylococci. And staph can also be put into a smaller subset where they are in a cluster of spheres. So on the right hand side, this is an electron micrograph of what tuberculosis would look like. So when you think of bacteria, you always think of something bad. In fact, very few bacteria can cause illness in the body. And bacteria is actually helpful to you. So without bacteria, you wouldn't have cheese that goes on your pizza. So bacteria is needed in order to grow lots of other things. So there's different shapes again. And the fun fact about bacteria is bacteria actually helps our bodies to digest things and produce vitamins. It helps to destroy harmful organisms in our body. And there are more bacterial cells in your body than there are human cells. So most bacteria reproduce using a process called binary fission. To do this, a single bacterium will grow to twice its normal size, and then it splits into 2 daughter cells. And I've actually drawn this on the board a couple times. And these 2 new cells are the exact copies of the original bacteria. So dead or weakened bacteria and viruses are useful for making vaccines. And scientists estimate that bacteria produce nearly half of the oxygen found in the atmosphere. So bacteria are helpful. It's used to purify water at sewage treatment plants. Bacteria helps to break down oils after oil spills. And given the proper environment, you could actually produce a colony of more than 2 million bacterium in just 7 hours. And bacteria are present all over your body, and specifically there's one area, your skin, where you may have more than 500,000 microbes there. So don't think of all bacteria as bad. Looking at this next picture, I don't want you to know all the different parts of it, but I do want you to notice the small tail or the flagella at the bottom of it. So the pili are the little hairs that are extending the green part, and then the flagella is the tail. So that originates in the cytoplasm membrane, and the cell wall is different among all different bacteria. So these are different parts, bacterial species in analysis and differentiation. So that's how we can tell them apart, by the different parts. Alright, here's a picture of the bacilli on the left. So these are rod-shaped cells, commonly referred to as endospores. So tetanus and botulism are two different endospores. And you know, the rod shapes, they're joined together at their ends to form longer chains. So typically tetanus will be formed in that longer chain. So endospores, these are a latent form of bacterium that have a protective coat that can survive high temperatures and dry conditions. And when we think of tetanus, we think of you stepping on a nail that's been outside maybe for a while, maybe it's been exposed to high temperatures, maybe it's been exposed to dry conditions, and that's why tetanus can survive for so long. So when you step on that rusty nail, even though it's been outside, it may have tetanus in it. Botulism is another interesting one, and if you've ever pulled out a can from your cupboard at home and noticed that the top of it was kind of pushing up, like there was pressure building up in the can, that's typically caused from botulism. And botulism can be caused in kids that are too young who are given honey, because honey doesn't go through any type of a purification process. It's not heated or pasteurized, and typically with infants, you can't give them honey because then they would end up with botulism. So again, there's those cans on the shelf. If the top is pressing up and the date is expired on it, you know that it may have botulism inside of it. And then again on the bottom, we see honey. And then on the right side, that's what someone experiencing tetanus or lockjaw would experience. So the toxin in the bacterium causes seizures, it causes muscle spasm, and eventually it causes respiratory failure. So here's some more spirals, different types of bacteria. So one of the common ones that I'd like to talk about Lyme disease. Lyme disease is a bacteria spiral. So cells that look like they're shaped like corkscrews are called spirillums, which are pictured in the top right-hand picture. And looking at the bottom picture, that is what Lyme disease looks like. Unfortunately, that bullseye rash is only present in 30 to 40% of the cases. So if you have an athlete or you're working with a patient and they're experiencing fatigue, they're experiencing joint pain, that's someone that you should refer in to test for Lyme disease. One of the side effects of Lyme disease is also Bell's palsy, where they'll get one side of their face may start drooping, and it appears like they're having a stroke, but it's actually Bell's palsy, and it's caused from Lyme disease. So make sure that you're getting that checked as soon as possible. Lyme disease is very common in North America, and again, it's spread by field mice and deer ticks. So it can eventually affect the brain, the heart, the joints, causing severe arthritis if it's not taken care of sooner rather than later. So the next type of bacteria, an example of the cocci, we have the diplococci, which are your pneumonias. The streptococci, you've probably all had strep at some point, is one type of respiratory infection. And then the staphylococci are responsible for MRSA. So MRSA is methicillin-resistant Staph aureus. And that's a very difficult infection that's difficult to treat. There's very few medications that can be used for that. So with that type of an infection, it typically looks like some type of a bug bite that they may have. And I'll show you a picture of it on the next page, what it looks like. And they have to go in, they get a sample taken, it gets tested, and if it comes back positive for MRSA, there's one type of medication. So with all of these bacterial cocci that we have, they're spherical, they're kind of all clumped together like in the top left-hand photo. So instead of forming chains like rods or spirals, these form clumps instead. So on the left-hand side, this is typically what a MRSA infection will look like. It initially starts like it's a bug bite. It may have a small pustule on top of it, and get that sent in as soon as possible. Within 24 hours, this can cause a severe infection that may cause amputation if it's not taken care of and treated properly. And again, we get all of these tested at health services. As soon as someone comes in with this, they get referred over, they get it tested, and they get put on the medication. On the right-hand side is one of the treatments that's available besides medication. And if you want to take a guess at what those little things are in there, that is an example of maggot therapy. During the Civil War, we did not have antibiotics. And if people came in from the battlefield and they had an infection, maggots would sometimes be introduced into the wound, and they were very efficient at cleaning out only the dead part that needed to be taken care of and leaving the healthy tissue. So this is a way now that we've actually reinstituted the use of maggot therapy. They go through a sterilization process that doesn't kill them, and then they're introduced into the wound and a dressing is placed over them, and then when they're done feasting on the dead cells that need to be removed, they're taken out. If any of you want to do an article review, I think that's a great topic to look at, is maggot therapy in 2014. So again, bacteria, is it your friend or is it your foe? Different types of toxins fall into this category. We have our exotoxins, we have our endotoxins, and the exotoxins help with antibody and antitoxin production. So when you hear things like a gram-positive stain or a gram-negative stain, this is what they're referring to in the toxins. So just remember that exo interferes with nerve conduction. So if we're talking about an exotoxin, it's going to be something that is used to treat tetanus. And it helps to reduce the toxic effects or stimulate the immune response in the body. So with our endos, typically people have fever and weakness. They may go into endotoxic shock. So let's move on now. So we're going to look at viruses. So this is an example. The photo on the right is your toga virus. So lots of different viral diseases that are out there. You can read through this list. You've probably heard of some of these. Maybe the retrovirus you've heard of. Let's see if there's any more. The herpes virus is a common one. Most of these you have not heard of, but there's lots of different types. There's lots of different subtypes. So a virus is considered a very small intracellular parasite. And what's different about the virus is the virus actually needs a living host for replication. So it needs something to live off of. And if you notice the picture of the virus on the left-hand side, you'll notice those little tails, and those latch on to the host cell, and they actually take the structure of that cell, and they're able to take and change the DNA or the RNA of the cell and make it their own. And that's how viruses replicate. So again, without a host cell, those viruses cannot carry out any life-sustaining functions, and they cannot reproduce. So the reason they can't reproduce is because they cannot synthesize proteins, and they lack ribosomes. So what they do is they use that host cell to translate this viral messenger RNA into different types of viral proteins. So viruses can't store energy, they can't generate energy, they can't produce ATP, but they have to derive their own energy and all their metabolic functions from that host cell. So they're considered parasites because of this. So when a virus is extracellular, extra meaning outside of the cell, the virus particle is called a virion. So that virion has a protein coat, it has a core of DNA, and it has RNA. So different shapes you see, you'll see rods, you'll see filaments, you'll see spheres. And new viruses assemble by different processes. So instead of replicating through one cell, developing into two daughter cells, they actually are replicated by budding, and budding from a host cell membrane. So with that budding process, it replicates the same virus, and there it goes on to infect more cells. So when we talk about antiviral drugs and how they work, they actually reduce the rate of the viral replication. So it doesn't stop the virus from progressing, it just slows down the process. That's how an AIDS medication or an HIV/AIDS medication would work. It slows down the replication process of the virus. Alright, the next one we're going to look at is we're going to look at fungi. And this on the body is an example of Tinea corporis. So whenever you see the word tinea, you should associate that with fungi. So fungus are found on animals, plants, humans, and food. We have it on our skin. Sometimes it can grow and replicate too much. And it grows with warmth, it grows with moisture. So think of the parts of the body that have lots of cracks and crevices on them. That's typically where we'll see fungi grow or fungus grow. So this is a picture of ringworm on the left-hand side. That would be the layman's term for Tinea corporis. And fungus is very difficult to treat. Typically, there may be an oral prescription or an oral antifungal that's given to the athlete or to the patient. There are topical applications, but if any of you have ever had athlete's foot, you know that it's very difficult to treat topically. So few are pathogenic. So Tinea pedis is athlete's foot, and candidiasis is basically a yeast infection of the skin. And a few years ago, I was in Florida with an athlete, and she was very uncomfortable with her uniform, and I asked what was wrong. And she had candidiasis in her axilla, or in her armpit. And I asked her what she'd been doing for it, and she said that she was taking medication that sometimes made her vomit in her sleep, and she had to go in and have liver tests done every month to make sure that she wasn't destroying her liver. And when I saw it, I recognized what it was. I knew that it was yeast. So we walked down the street to CVS, and we went in, and I actually bought her medication that's used to treat a yeast infection in women. And we took the cream from that, and we rubbed it basically in her axilla 3 times a day, and within 7 days that candidiasis was cleared up. So when you see these infections, if you're not quite sure what they are, make sure that you're referring them to either the team physician, their primary care physician, or a dermatologist. But if you want to try some of the topical treatments and see if it helps, give that a shot, because sometimes that's faster and it's less expensive to do that. So again, here's that budding process that I had talked about with viruses. So fungi reproduce through budding, and you can see the little bud that's developing on the bottom of one of those cells, and then the bud breaks off and goes on to attack other cells. So budding, we have an extension of the hyphae is another way, and fungus can also produce spores in order to reproduce. So those are the ways that they reproduce. So fungus can reproduce by budding, an extension of the hyphae, and then production of spores. So how do we prevent infection with fungus? This is one of the reasons we have lots of rules in our athletic training room. There is no sharing of equipment. There's no sharing of towels. When people come in, they should have footwear on, not exposing their feet to other fungus that may be on the floor that hasn't been cleaned properly, or just someone else has tracked it in and now they're going to pick it up. So make sure that you have guidelines for your athletes and go through ways that they can have good hygiene so that they don't develop different types of infections and pick up fungus. So the next one we're going to look at is protozoa, and protozoas are eukaryotic unicellular, so one cell. These guys lack a cell wall and they change shape. So these can live independently or on a host. So think of some type of a dead organic material where a protozoa may live. So different types of parasites. We have parasites that are responsible for trichomoniasis. We have different parasites that are responsible for malaria, and then amoebic dysentery. So trichomoniasis vaginalis is a sexually transmitted disease. STD, or an STI, is sexually transmitted infection. It can be transmitted through other routes. So soiled towels has actually been documented. So again, no sharing with your athletes. So most people infected with that are asymptomatic, meaning that they don't have any symptoms. Typically, infections, they'll have a white discharge from the genital tract. They'll have itching with this. And there are cases where numbers of organisms are very low, and you can actually culture them to increase the number that are found. So malaria we're going to talk about in a little bit. We're going to not touch on amoebic dysentery right now. But what I want you to notice is in the picture on the top right hand is you'll notice the trichomoniasis vaginalis. You'll notice that has that little tail there. Okay, it has a flagella that helps it to be mobile and to move. Other types of parasites, hopefully these are things that you're not going to see in the population that you're working with. Maybe if you're traveling to some type of third world country, or you're on a mission through some organization, you may come in contact with these. So we have our helminths, which are worms. And these guys are not microorganisms. These are actually parasites and can cause infections in humans. So examples are tapeworms, roundworms, hookworms. People that have these worms, they typically will be anemic, and it's because the worms are taking some of the nutrients that they need in order to live. So parasite infections affects millions of people worldwide. So the impact of HIV and AIDS, we've actually seen new parasites develop because of this, because that immune system gets infected. So different changes in global warming has actually spread a lot of these parasites as well. Breakdown in sanitation leads to the development of parasites in the population. And if you look at the United States, you look at places like the United Kingdom, parasite infections are relatively uncommon, but outbreaks associated with drinking water are very large as well. And some of the other ones that I've mentioned before, as I've mentioned, the cryptosporidium is very common in the water, especially in the drinking water in different areas of the country that are affected. So the life cycle with these parasites, they start as an ovum or an egg, then they develop into a larvae, and then they develop into an adult. Alright, so a VIRATERIA. So it's kind of like a cafegymnasium or a cafeteria gymnasium in elementary school. But these three groups of microorganisms all have similarities to bacteria and viruses. So chlamydia is a common STD or an STI that causes pelvic inflammatory disease and sterility in women. Rickettsia is a gram-negative bacteria that lives in a host cell and is transmitted by insects. So think of ticks, think of lice. An example of this is the Rocky Mountain spotted fever. And then the mycoplasma infection is a common cause of pneumonia. And what's unique about those mycoplasma is that there's no cell wall, and they're not affected by antimicrobial drugs. So that's one of the difficult things to treat. So principles of infections. We're going to look at different ways that infections are spread. We just have a few more slides to get through, and I appreciate you hanging in there. So we can have transmission through direct contact, indirect contact, droplet form, and vector form. So we're going to look at the different ways that we can transmit those microorganisms and the methods of control for the prevention and control of infection. So take a look at that in your textbook. I want you to review the different modes of transmission. And then lastly, sterile areas of the body. There's quite a few areas that are considered sterile. Number one is the stomach, which this guy has drank a lot of beer. So that the stomach lacks resident flora in it, meaning that it's a sterile area of the body. Your lungs are also sterile, and your bladder. And if we have bacteria that's introduced into those areas, that's typically when people get infection. So bacteria being introduced into the bladder, we'll have a bladder infection. And then we have this resident flora that is on our body. We have some of these different types of microorganisms on our skin. We have them in our nasal cavity. MRSA is one of those that's in the nasal cavity that people carry. And then also in the mouth, we carry a lot of bacteria as well. So how do we control for the transmission of these microorganisms? How do we prevent infection? So when working with people, you always use universal precautions. So any body fluid, blood, body fluids, consider them all infected. Even if you know the person, even if you know the athlete, if you know the patient that you're working with, we always use universal precautions. So that means that we're putting gloves on, we might be gowning up, we might be putting a face shield on if there's a potential for body fluid to come out and come in contact with us. Make sure that you're cleaning surrounding surfaces and clothing. So we make sure that all of our laundry is done at over 150 degrees in order to kill these microorganisms. It's important that you make sure that your laundry that's cleaning athletes' uniforms is done at the correct temperature, as well as towels and any type of bedding that's used. So sterilization of tools is important. We have a machine that's called an autoclave, and we put all of our scissors, scalpels, tweezers, anything that we use that touches someone, we put them into the autoclave and make sure that they're sterilized. We have disinfectants that are used in our room. When I first started working at Tufts, I was using this pink spray to clean all the tables and surfaces, and after 2 years I found out it was window cleaner that had no cleaner or no disinfectant in it that would address hepatitis B, HIV, AIDS. So we now have something that takes care of all the different microorganisms and kills them all. And then antiseptics that are used as well to clean things. So before handing someone something as simple as a pair of tweezers to take out a splinter, before handing them a set of toenail clippers to clean their toenails, make sure that you're cleaning that piece of equipment properly. I always take an alcohol pad out and I'll clean off the toenail clippers before someone uses them, because you never know if someone before them may have had some type of infection, and if they come into contact with it, they may become infected as well. So we know now how to control infections, we understand infections, and breaking that chain of infection is a priority by using all of these methods of universal precautions. So again, make sure whenever you're working with someone that you consider all body fluids and waste are considered infected in any client. Alright, so for next class, I'd like for you to start working on Chapter 5, Neoplasms. You are going to be having a guest speaker that comes in soon to speak to you about respiratory infections. So Anita Chase will be coming in to talk to you and give a lecture as well. So thank you for your time. I hope that this was helpful for you. If you have any feedback, any criticism, please let me know, and I will be happy to listen to you.